Welcome to Spine Guy. I'm Dr. Brian Sue, a fellowship-trained spine surgeon. The Spine Guy is a channel dedicated to making the complex spine simple for patients to understand. Today we'll be talking about lumbar spinal stenosis, which is a pinched nerve in the back that can cause back pain, buttock, and leg pain. It's important to understand that there's two very different types of lumbar spinal stenosis. The first is called Central Lumbar Stenosis, which sometimes is also called lateral recess stenosis, but it really just denotes compression of the nerves in the center aspect of the spinal canal. That's already been covered in another video and playlist called Lumbar Spinal Stenosis, and that link is below. Today we'll be talking about a different type of stenosis, which is called Lumbar Foraminal Stenosis. To review a little bit of the anatomy, this is low back. There's the front of the spine, there's the back of the spine, there's bones and discs, so these are the individual bones. They're named by number, L5, L4, L3. There are discs that cushion the bones, so that disc is between the L4 and L5 bones, so it's called the L4, L5 discs. And then you have nerves that come down in the back, and those nerves exit, and when they exit and they come down the back, through the buttock, down the leg, they come out of something called the foramen. The word foramen means window, and you'll see that there's a window where the L4 nerve is coming out at the L4, L5 level. You'll see that the front of the foramen is a disc, the back of the foramen is the facet joint. The facet joint is that joint right there, which moves as the spine moves. And the top and bottom of the foramen are each of the respective vertebral bones. The nerve in the foramen can get pinched, and that can lead to stenosis, or foraminal stenosis, which just means pinching of the nerve inside the foramen. Again, that foramen is just a window where the nerve is coming out. Stenosis is just a fancy word for narrowing. Many things can be stenotic. A highway could be stenotic because there's traffic. In this case, the foramen is stenotic because there's something that is compressing the nerve inside that foramen. There are four different types of causes of foraminal stenosis. The first is you can have a disc herniation. So what can happen is the disc, which is like a jelly donut, that disc donut layer can tear, the jelly can spit out and hit the foramen. Sometimes there's a bone spur that comes off the facet joint, and that bone spur can hit the foramen, as you'll see here. But more often than not, the two main things that cause significant foraminal stenosis that we see is one is disc height loss and disc degeneration, and the other is scoliosis or abnormal curvature. You'll see that this is a normal height of the disc on this model, and that's where the nerve is coming out that foramen. And over time, just because of age-related changes, that disc can collapse, and as that disc collapses, the foramen gets narrowed, and so there's no space for the nerve in an up-down direction. So again, there's the disc at normal height, and then you can see over time, as that disc collapses, there's nothing that's holding that foramen open in an up-down direction. The other thing that can compress the nerve is scoliosis. Scoliosis is abnormal curvature of the spine. Some patients over time develop a curvature of the spine. If there's curvature of the spine, what can happen is that nerve, as it's trying to come out, can get compressed because of that curvature of that spine that's pinching the nerve. Here's an example of an x-ray of somebody. This is the side view or the lateral view. Let me show you a normal x-ray. There's the back, there's the belly, you see the bones here, you see the discs. And I circle where the foramen are. You can see the foramen at the L4, L5 level and L5, S1 level are really the same height in this patient with a normal looking spine. So here's a patient that has severe degenerative disc disease at L5, S1. So what's happened at the L5, S1 level is that disc over time has collapsed to L5, S1. As a result, you can see his normal foramen at L4, L5, and you can see the L5, S1 foramen as a result of the disc height collapse. That foraminal space as an up-down area has gotten much narrower. And here's an MRI, so there's the belly, there's the back, there's the L4 bone, L5 bone, there's the S1 bone. You can see quite a bit of degeneration at the L5, S1 level. This is called the sagittal view or the foraminal view, and this really is a cross-section of the spine this way, so you're looking into the spine like that, where you can actually see the foramen. And here you'll see the L4 nerve at the L4, L5 level, and that gray thing is the nerve coming right out at you in that MRI. And you'll see at the L4, L5 level, there's plenty of white, which is fluid and fat that's sitting around the nerve at the L4, L5 level, so that's normal. At the L5, S1 level, where there's quite a bit of disc height collapse, you'll see narrowing of that L5, S1 foramen, where you'll see the L5 nerve now getting pinched in an up-down direction. You can see how much shorter it is at L5, S1 versus L4, L5. Here's another example of a patient with scoliosis. So this time is that example with a patient with a normal spine is straight, with a curved spine. As that spine starts to curve, what can happen is a nerve can get pinched. Now this patient has a curve both in the upper lumbar area and in the lower lumbar area. This patient had pain in the buttock and leg, which is coming from the lower lumbar area, particularly L4, L5. So you'll see that there's asymmetric collapse at the L4, L5 level. That disc is not supposed to look wedged like that on the front back view. It's supposed to look straight. And here you'll see on the CT scan at the L4, L5 level, you'll see that there's an open space on one side where the disc is normal, but because of the scoliosis and the asymmetric collapse, there's bone spurring collapse on the other side of the disc. Now this is again the foraminal view, so this is the side view. This is a CT scan, which is a nice view of the bony anatomy. I showed the painful side of this patient, which is the left side, and the non-painful side, which is the right side. So on the left side of the patient, you'll see L4, L5 disc height collapse. You'll see that space at the L4, L5 foramen getting narrower and narrower up down with compression of the L4 nerve compared particularly to the L5, S1 level. And here you'll see the same patient's other side, which shows a normal foramen at L4, L5 compared to the L5, S1 level, and a much taller foramen because that disc height is much taller on that side. So this is asymmetric disc height collapse from scoliosis. This is the MRI that shows soft tissue. You'll see at the L4, L5 level, there's lots of disc height collapse and compression of the L4 nerve at the L4, L5 foramen because there's disc height collapse, as opposed to the other side where you'll see that nerve is totally free because that disc on the other side is still maintained its height because of the asymmetric collapse. So what happens if you have nerve compression? Well, if you have nerve compression, it causes something called radiculopathy. The word radiculopathy just means pain in the distribution of a nerve. Each nerve does something different, and usually when there's foraminal stenosis, it's only one or two nerves that are being compressed, most often the lower lumbar spine, so you're often looking at L3, L4, L5. So for example, in that patient with the L4, L5 asymmetric collapse, the L4 nerves involved, so this patient would typically complain of buttock and leg pain, pins, needles, tingling, going from the back through the lateral hip, buttock, all the way coming down across the knee and then going down to the foot. And often, because each nerve also supplies a muscle to give it strength, sometimes when the nerve is really compressed, you can start getting muscle weakness. In the case of the L4 and the L5 nerve, you can get a foot drop, meaning as you walk, your ankle can't lift itself off and the foot starts to slap. As an aside, sometimes foraminal stenosis can also cause back pain, but really the thing that patients complain the most about are buttock and leg pain as a result of the nerve compression. Hopefully you learn about what foraminal stenosis is and why it's different than normal central or lateral recess stenosis. In the next episode, we'll be talking about non-operative treatment of lumbar foraminal stenosis.